Now let's discuss when things go wrong during babysitting. Problems or emergencies while babysitting can be confusing and stressful. A babysitter will need to stay calm and figure out how serious it is, and then figure out what type of help is needed. As a babysitter, it is your responsibility to keep the children you are watching safe. A best way to keep a problem from happening is to always stay in the same room as the child and stay focused on them. However, things can still go wrong. When something unexpected happens, think about whether the problem you are facing poses a serious danger and can get worse with time. Serious problems that could threaten the safety of you and children include illnesses or injuries that occur suddenly or without warning, a person or group of people that appear threatening, a location that becomes unsafe. If you are faced with a sudden or unexpected change, pause for a moment. Make sure it is safe for you. Try to form a general impression of what is going on. And if a threat exists, stay calm as you can. Try to determine the level of risk and how quickly you need to react to it. Now it's time to take action. It is normal to be nervous or hesitant about helping when a problem occurs, but a babysitter who acts to help can improve a situation until more help arrives. So let's talk about personal safety. When you are facing a problem that affects both you and the children you are watching, do your best to stay together. When a problem involves a single person, consider your personal safety and the safety of others who are not affected as the highest priority. Do not let what happens to someone happen to you or others. Don't go near a person if you feel you might get hurt or sick too. Putting yourself or others in danger can make the situation worse. Always pause for a moment before approaching and make sure that it is safe for you to help before getting closer. Look for obvious hazards. Consider the possibility of hidden dangers. If you can safely approach, do so. If the situation is clearly unsafe, do not get any closer. If your current location is unsafe, get out. Try to keep yourself and children clear of anything that could be harmful. Getting help. You are never alone when things go wrong. Help is just a phone call away, and calling for help is always okay. For small problems, you can call a child's parent or your parents. The National Poison Helpline is 1-800-222-1222 and can be called anytime you think a poisoning may have occurred. A trained poison specialist will help you figure out whether or not something is poisonous and what steps to take for immediate care. Remember to call parents as soon as possible. Call 911 if you think the child is seriously ill. When you think a problem is more serious or dangerous, emergency services are quickly available by calling 911. Emergency providers, including paramedics, police, and firefighters, can rapidly respond to your location and help. If the problem you are facing is serious, call 911 first before calling parents. The most important thing you will be asked is the address of your location. Some things to do to help before they arrive. When an emergency occurs or there is a threat nearby, a babysitter can help keep kids safe until they arrive. When you call 911, in most cases, it will take a few minutes for emergency providers to arrive. While waiting for them, you can take action to help control the situation. There are high priority problems that require immediate action on your part before emergency responders arrive. When encountering force on the body, like someone falling far or being hit hard by something, you want to call 911. Do not move the child unless he or she is in danger or being hurt worse. Encourage the child to stay still and calm. And if the child is in an awkward position, use your hands to help him or her head or injured limbs to stay still. When encountering an unusual or reduced mental state, like someone isn't acting normally, if unresponsive, watch the child's chest for 5 seconds to see if he or she is breathing. If the child is not breathing, start CPR. If unresponsive and breathing, and there has not been a significant force to the body, roll the child onto their side and monitor their breathing. When encountering difficulty breathing, if a child is breathing but having trouble doing so, be supportive. Have the child rest in a comfortable position. Loosen any clothing from the chest or neck that might be making it difficult to breathe. Calm, comfort, and reassure the child. Coach her or him on taking slower and even breaths. When encountering someone with blocked airways to the lungs, choking can occur when an object such as a small piece of food or a toy gets stuck in the airway. If a child is coughing or gagging, encourage them to keep coughing and stay close and be ready to act if things get worse. When severe blockage occurs, a child cannot take enough air in to dislodge the object. Signs of severe choking include making little or no sound, an inability to speak or cough forcefully, or hands held to their throat. Repeated forceful thrusts up into the abdomen beneath the ribs can pressurize the air in the chest and pop a severe object out of the airway. If a child becomes unresponsive while choking, CPR will need to be performed. Be sure to take a CPR and first aid course in addition to these babysitting tips and recommendations. When encountering someone with heavy bleeding, if a child is injured and you see signs of heavy bleeding like blood on the floor or clothing, take immediate action to help. To protect yourself from exposure to disease, it is recommended you wear disposable gloves. Keep gloves in your babysitting bag. Apply direct pressure to control visible bleeding until emergency help arrives. As you end your babysitting day, parents will come home and want to hear all about your time with their children. Be prepared to share with them what and when the child ate, how many diapers you changed, what time they went to sleep and for how long, what games or activities did you and the children enjoy, were there any challenging behaviors, and if you noticed any hazards that you had to avoid during your babysitting experience. Remember, a good babysitter is respectful and responsible throughout all of the job. This includes the ride home. Thank you so much for participating in our babysitting recommendations and tips. We pray that your experience is a safe and joyful experience. Thank you.